Calcarea carbonica, Calcarea crab, Materia medica. Introduction. Calcarea carbonica, commonly referred to the Calcarea crab, is one of the major polycystic remedy in homeopathy. It is derived from the middle layer of ostracycle. This remedy has a wide range of action and is often used for deep seated chronic diseases. Calcarea crab primarily act on individuals who exhibit physical and mental sluggishness, slow development, and who are prone to cold and damp conditions. Clinical effective in training alignment related to improve nutrition, growth, and metabolism. It is address delay, millstone respiratory tube, digestive disorder, and weakness of bone. Useful in conditions such as bronchial asthma, tuberculosis, and various menstrual disorder. Sphere of action. Calcarea crab act profoundly on the musculoskeletal system, gland, digestive system, respiratory system, and reproductive organ. It affects the nutritional process leading to improper metabolism, defective bone formation, and glandular swelling. Pathogenesis. This remedy work on the lymphatic constitution which individuals suffer from defective calcium metabolism, proper absorption of nutrition, faulty elimination process. It is linked to condition arising from improper nutrition and tissue degeneration. Constitution, physical appearance. Individuals are usually fair, fat, flabby. They are slowly in their movement and mentally sluggish. Temperament, generally anxious and fearful with inclination toward despair regarding health. Chilly constitution. These patients feel extremely cold and are sensitive to draft of air. Guiding symptoms. Sluggishness in both mind and body. Fear of lows, reason or going insane. Excessive sweating on the head during sleep. Coldness of extreme, especially hand and feet. Tendency toward weight gain with slow metabolism. Prognosis to catching cold easily. Coldness. Mark coldness on head, hand, and feet. Patient desire warm, dislike cold air, and aggravated by exposure to cold. Mind. Anxiety. Persistent worry about the health and fear of future misfortune. Mental dullness. Inability to comprehend quickly, slowly in processing through, and lack of concentration. Fear of illness, insanity, and death. Fear of misfortune or losing control of oneself. Alignment from resulting from exposure to cold, overwork, and mental strain. Suppression, eruption, or glandular swelling also lead to chronic alignment. Particular gastrointestinal tract complaint related to slow digestion and improper nutritional absorption. Mouth, bad breath, gum problem, and excessive salivation. Stomach, weak digestion, acidity, and aversion to certain food, especially milk and fat. Abdomen, distended abdomen with a tendency for constipation. Stool, hard, dry, and difficult to pass. Constipation is a common complaint in calculator patient. Respiratory organ, nose, chronic catheter leading to blockage and loss of smell. Cough, dry, spasmodic cough, worth at night or from exposure to cold. Bronchial asthma, useful in bronchial asthma, especially when accompanies chronic respiratory condition. Tuberculosis, indicate the tubercular diathesis, which where there is a tendency toward development of permanent tuberculosis. Throat, chronic throat infection, enlarged tonsil with frequent suppression and pain. Menses, profuse and prolonged menses associated with weakness and exhausted, from accompanied by leukorrhea and back pain. Leukorrhea, thick, yellow, and acrid. Leukorrhea causing intense itching and discomfort. Uremia, related to chronic kidney disorder and the accumulation of waste product leading to uremia. Bone symptom, big bone, delay closure of frontlets and tendency toward ricket in the children. Bone deformity, soft brittle bone with a slow healing tendency. Calcarea crab is different age. Old man, complaint on joint stiffness, slow metabolism, chronic rug and coldness. Young man prone to glandular swelling, respiratory trouble, and poor digestion. Young girl tendency of menstrual irregularity and leukorrhea. Baby delay teething, show development, open frontalis, and tendency of rickets. General modality aggravation worse for cold air, damp weather, mental or physical exertion after meal, amelioration better from hearth rest and lying on the affected side. Relation complementary with belladonna, sulfur, silica, antidote nitric acid, incompatibility, bright crab. This detail overline cover all the essential aspects of Calcarea Carbonica that are likely to be asked in 20 mark university exam question.